Good morning, everyone. We are so excited to be with you talking about our field of music therapy that we've all kind of dedicated our lives to. And we're so grateful to be speaking at this conference here at UGA. So thank you to Anna for thinking of us and inviting us to speak. My name is Sally Ann Nichols. I am an academic professional in music therapy here at the Hughes Hodgson School of Music. And these are my two colleagues. I'll let them introduce themselves.
I am Dr. Ellen Evans, and I am an assistant professor as well as the area chair and program coordinator for the music therapy program here at UGA.
And I'm Jenny Stoll. I'm an assistant professor in music therapy, music therapy program here in the Hugh Hodgson School of Music.
And today our plan is to take you through a little bit about our backgrounds as music therapists and how our program is serving in 3 different capacities in the Athens community. And then we're going to talk a little bit about individual wellness and how we have a few strategies that we can suggest to you and whoever watches this online later to improve your own individual wellness. So just to give some background information, my primary focus as a music therapist has been in the medical setting. I primarily have worked in hospitals across different kind of floors and needs in the hospital, also specifically in rehabilitation, and you'll see a little example of that later in this presentation. And additionally in mental health, working with active duty service members in the United States military who are recovering from traumatic brain injury and post-traumatic stress disorders. That's my background expertise.
My clinical background is mostly on the end of the spectrum with older adults. I worked for about 8 years as a hospice music therapist, working with hospice patients and their families in that time of need, and then providing bereavement support to caregivers after their loved one passed away. And that work really kind of informed my research interests, which is providing psychosocial support to long-term caregivers after seeing kind of the physical and emotional toll that caregiving took on the loved ones who cared for older adults with neurodegenerative illnesses.
And then I'm on the opposite spectrum. All of my clinical work has been in children's hospitals, primarily in neonatal intensive care units, so working with premature infants through about the age of 5, so through early intervention. That's kind of my area of expertise, but also have worked across the lifespan in medical hospitals as well, so all the way up to some older adults that we might see in the hospital as well. But most of my research interests lie in that early intervention and premature infants, and looking at the neuroscience, looking at what we are doing and why it is working, and kind of been starting to investigate that. And then what are the long-term implementations of what we're doing with these little bitties when they get older and how we're affecting them long-term. So first we want to start with what is the definition of music therapy? What are we talking about here? Let's put a definition on it. And this comes from the American Music Therapy Association, and I'll read it to you and we're going to Music therapy is the clinical and evidence-based use of music interventions to accomplish individualized goals within a therapeutic relationship by a credentialed professional who has completed an approved music therapy program. And so some key pieces to point out in this is that we are evidence-based, so everything that we do is backed in research as well as patient preferences, as well as that relationship with the clinician. And so that is the other really key important thing in this, is that it does need to be in a relationship with a credentialed professional. And it's that therapeutic relationship that we form with our clients and patients that help to really show the benefits of the work that we're doing, as well as we are making individualized goals. So we do assess and decide with the client or with the medical team or with the interdisciplinary team what those goals need to be, and they are tailored to our clients and the needs that they have. Speaking of credentialed professionals, let's talk about how we become music therapists. So the first thing is that we are a bachelor's level entry field in the United States. And so that means that they complete a 4-year undergraduate program or an equivalency program. So maybe they've gotten a degree in music, maybe music education or music performance, and they decide to do the coursework to be a music therapist. That's what that kind of looks like. And then they do a 6-month internship. And so prior to sitting to their boards, between that time they're with us here at UGA and then their internship, they get 1,200 clinical hours. And those are completely supervised by a board certified music therapist. They then sit for their board certification exam through the Certification Board for Music Therapists, and that's where the MTBC credential comes. So if you see someone saying they're a music therapist but without that MTBC, that means they've not sat for their boards. They're not a board certified music therapist. We have recertification cycles every 5 years, so we do continuing ed like lots of credentialed professionals do. And here in the state of Georgia, we actually have a licensure. So we are actually licensed by the state. And currently right now as a field, we are working on gaining licensure or some sort of state regulation. And we're kind of working state by state. And Georgia was one of the first ones, so we're really proud of that. Then we have additional trainings that you can do to specialize with specific populations. Those include the NICU training that I have done and that I now do and provide to others, as well as the neurologic music therapy training that Professor Nichols has.
So when we hear the word music therapy, I think that by the definition and hearing about the credentialing process and the training process, we've explained a little bit about the difference in clinical music therapy. But when you look up music therapy research, there's a lot of people that use music to improve health and well-being, which is this whole conference, right? So we wanted to talk a little bit about some of those differences that you might see when you look up some sort of research article and you see music therapy listed. And so a couple of those differences. So we've already talked about music therapy involves, it's a healthcare profession. We're an allied health profession. One thing that I wanted to bring up about our credential is that the certification board for music therapists is approved through the Institute of Credentialing Excellence, which is the same body that holds speech language pathology's credential, that holds occupational therapy's credential, that holds some nurse practitioner credentials. So we're kind of in the same field as a healthcare profession, like some of those other disciplines. I've already talked about how music therapy is facilitated through a therapeutic relationship. Another difference is in our interventions. Music therapists will mostly use active interventions. Our research has shown that actively engaging, and I'm sure you've heard in the conference so far, actively engaging in the arts is going to be the most helpful for people, but we also might use some passive interventions. I'm thinking if a person's in pain, they might be anxious, and that's when a passive intervention might come into play. We always use patient-preferred music. So in our training programs, we train our students to work with any kind of music that a patient might like. So I have been in the hospital, and one day I'm working with a sweet little old lady that really likes gospel hymns, and I'm singing How Great Thou Art. And then the next room over, I am playing Kendrick Lamar or Hotline Bling, depending on what side you are of that argument. So we're training our students to work across disciplines, and if they don't know that kind of music, then working with the patient to actually be able to use what they know and what they feel most connected to. And then obviously music therapy, we're always targeting health goals. So we understand that. But then there's also music in medicine. And the best example that I like to think of this as is, for example, a doctor giving recorded music in an iPod to a patient before going into surgery to help reduce their anxiety before surgery. So in that example, it's a singular intervention. It's music listening. It's administered by someone that's still in the healthcare field. So someone like a doctor, a nurse, it could be a physical therapist who's using music while a patient is exercising to boost that motivation. The interventions are usually passive, so it's just active listening or listening to interventions or listening to music. Usually recorded music that's using technology like speakers to be facilitated, but it also targets health goals. So this is also a great use of music in healthcare, but a little bit different from clinical music therapy. And then finally, the last piece is music volunteers. This is, for example, someone that might be playing music on a grand piano that's in the hallway of a hospital, or someone that bringing a group of students to perform at an assisted living facility. This is what I mean by music volunteers. Usually, some music volunteers might have a slight level of training, depending on where they are volunteering through. But again, usually a singular intervention, just music listening, passive, and it might be live or it might be recorded. So we just wanted to take a minute to go through those three distinctions so that whenever you're looking, if you're interested in learning more about music therapy and you go into the research literature and you see music therapy, sometimes like this music in medicine is actually what's happening, but it'll be called music therapy in the research. So go and look for if a board certified music therapist is involved in that abstract. And that's the way that you know what distinction it is. We're working on this in our advocacy, and that's why we're doing this now, just to share about these differences. But there's a lot of ways that music can be used. So as long as we're using language that helps distinguish these a little bit more clearly.
And we love all of the research because we need all of the research to back
Yes.
even what we're doing. So we're saying it's all great.
Yes.
And we appreciate it all. But I will say to be especially careful when you're looking for research from other countries. Again, it's great research, but that MTBC is really specific to North America. And so we don't have a global way that we do this yet. So when we get together for like World Congress for music therapy, the amount of training we all have in the room varies very widely as to what is considered music therapy in other countries and how you become a music therapist. So we, again, took a very US view for you guys today with our work. So let's talk a little bit about what we're doing in the community.
Great. So as I mentioned, my clinical experience and research interest is mostly with the older adult population. So when I came to UGA 3 years ago, I wanted to kind of tap into our community and see what was being done and what I could possibly offer. So I quickly discovered our Institute of Gerontology over on the Health Sciences campus, and they have a cognitive aging research and education center, which they call the CARE Center. And this is a interdisciplinary group of people looking to serve the community, made up of neuropsychologists, researchers, pharmacists, social work, and then I kind of plug myself in there too, just to provide support. So in reaching out to the faculty there, we saw a lot of overlapping benefits that we could offer. And so I started partnering with their social worker, who offers a support group for caregivers twice a month. And in that partnership, my students and I now provide music therapy to the loved ones with dementia while the caregivers attend the support group. So now we've removed that barrier of that caregiver having to find care in order to attend the support group. They can bring their loved one. We go do meaningful, interactive music therapy with the individuals with dementia while their caregivers attend the support group. The center is in the early stages of development. I lucked out that their timing in creating the center kind of fell at the same time I came here. So I got in the beginning, and we're looking for more ways to develop this partnership, which of course started with educating them on the benefits of music therapy. And then just yesterday we submitted a grant that's interdisciplinary as well. So we're hoping to see this partnership grow and ultimately continue to provide services to older adults within Athens.
I'll go next. So I'm going to talk a little bit about and talk to you a little bit about what we're doing with Extra Special People, otherwise known as ESP, here in the Athens community. It is a large organization that is now moving to be across the state. We partner just with the Athens location currently, and they serve over 400 families with that have someone with a disability in their family. And so we partner with them. And so they are a local organization, and they have a ton of community support and a lot of community backing. If you drive around town, you'll see ESP fans hanging up in local businesses. And so it is definitely a way that we could get involved quickly in the community. They already partner and use a lot of college students in what they do and in their mission. And so that was really easy for me to say, hey, I've got these college students that need practicum hours. Can we come here and do music therapy? You already have a music class. Can we take this and just enhance it a little bit and make it music therapy instead of just calling it music? And of course, they quickly bought in, and they serve in a wide variety of ages and diagnoses and disabilities. So they will not turn away anyone. And so we could be working with a 4-year-old, and we could also be working with a 65-year-old in the same day. And so there's a lot of variety, which is exciting, but also a challenge and great for our students.
And then the final partnership that our program has been pursuing, this is our 3rd semester, working with St. Mary's Hospital in Athens. We chose this location because there's only 2 hospitals in Athens, but this one has its only inpatient rehab facility. As of now, I've heard that there might be more in the future. Just like ESP, it was also a training site for UGA students currently, so we were able to meet with some of the rehab administrative staff to talk about the benefits of music therapy in the medical setting and in the inpatient rehab setting to start working with them. The other reason why we specifically wanted to work is because they're a comprehensive stroke center, and we'll show you a video of me working with a patient who has had a stroke, but music therapy is a very effective intervention for that population in a lot of different ways. And so that's why we wanted our students to get that experience as well.
So here you can see just some visuals from each of these. And so you can see at ESP, we provide mostly group services there. And so we do music therapy groups every afternoon when they have after school programming. I also do the 0 to 4-year-olds as well on Friday mornings, which is the highlight of my week every week. And so actually ESP brought in so much to what we were doing and how we were affecting change in their patients and in their clients and just the reactions they were seeing, that they actually sponsor a TA through our program. And so they actually support what the TA that you see right there is her name is Celia. And so they actually support her. And so now she goes out and is able to do even more than what I could do with our students. So that was a really great partnership that we'd love to see grow and thrive.
So as I mentioned, when our students finish their training, they are certified to work with people across the lifespan. So we're trying to expose them to all of these clinical opportunities while they're here completing their coursework. So the middle picture there is a couple of our upper level students who are with me at the care center doing our music therapy group with older adults with dementia. Obviously, in knowing that dementia is a neurodegenerative illness, we're not necessarily working on some of the improving skill areas that we might see in other settings, but we're really working on maintenance or slowing the progression of those diagnoses. So we do a lot of music for maintaining memory skills, right? And so we talked a little bit about the neurologic response to music, but we know that music is processed in all over the brain. And that's really neat to see in individuals with dementia because music can often work around the areas that are affected with dementia. So we'll often see, clients come into our music therapy group that can't tell us what they had for lunch a couple hours ago, but they'll sing every word to You Are My Sunshine during the session. And so we do a lot of music for maintaining memory. So a lot of kind of filling in the last word of lyrics. We do a lot of music for reminiscing and letting these older adults share their stories and experiences. And then that social component. This group is made up of individuals that still live at home with their spouse within the community. They're not in a senior living facility. So oftentimes that can lead to isolation because it is difficult to get out into the community, and go to the grocery store and go out to eat. So by coming to this group, they're able to be around other people, share their stories with each other, and then collectively participate in these music experiences, whether it's through, making music together through playing shakers and rhythm sticks and drums, or this intervention here was a little songwriting activity. We were talking about the upcoming holidays, talking about what they like to cook for Thanksgiving and what family traditions they had and were able to share with each other.
And then at St. Mary's, we work across the hospital on a lot of different goals. I say we teeter the fence between behavioral health and between rehabilitation. So when it comes to rehabilitative goals, just like Jenny was talking, we know that music is processed all over the brain, and I'll show you a picture of that in just a little bit. But because of that idea of neuroplasticity, our brains can change and regain areas that have been damaged by things like a stroke or like a traumatic brain injury. And so at St. Mary's, we specifically on the rehab unit, we might use things like exactly what she was saying. Whenever a patient has aphasia, for example, after having a stroke, when they know what they want to say, but they can't get it out, we know that even though they might not be able to speak, they're able to fill in the final word of a song. Or we might see a musical response from them when they might be flat and not completely there, which is what I want to show you a video of. On the other side of this too, we know that hospitals are a very unnormal and scary environment for a lot of people, causing a lot of acute anxiety, acute depression, a lot of spiritual issues as well, meaning of life issues. And a lot of healthcare professionals don't have the time to spend with people to be able to address those needs in the hospital. A nurse is just trying to keep someone alive. A physical therapist is just trying to get them up and mobilized. So having one other person, like a music therapist, who can bring something normal and familiar and soothing into this environment where it just doesn't feel like it makes sense, can be really meaningful and calming for these individuals who are hospitalized. So this video is what I wanted to show you. This is me working with a patient who has had a stroke. He is aphasic and also a bulic, which we think he's having difficulty just initiating speech. And here you'll see he's really flat. He just got out of the ICU at this point. And he's finally on the 7th floor, which is the neuroscience unit. It's a step-down unit. So he's physiologically stable, but we're still not getting a lot of responses out of him. And so what I was trying to do here is we were using his preferred music. He's a big Beatles fan. And so I'm using his preferred music, and I have got a drum under his hand because his family says that he is a tapper, he loves music, is really engaged with music. So I've got this drum, and this is the first true response to the environment that we got out of him. This is the first time we've seen anything intentional from him. So let's go ahead and play this. See that anticipation of the beat? Yes. That's his wife. See, he's waiting for the beat. Then we needed some cueing, some prompting to keep it going. And he's waiting on the beat again. And then so we saw it on the quarter notes, and then he starts on the half notes. So this is how we know he's intentionally responding to his environment. We don't see anything from his face, but this was the first moment that the family is like, oh, he's here, he's with us. And so really for us to be able to see him attending to the environment is the first step. And then from there, he was able to keep his eyes open more and engage more. And then we started working on getting him to fill in those blanks. Unless you want to hear me sing Hey Jude.
So we just wanted to give you a little sneak peek into all the other partnerships we do have right now currently. We have several more in the works, but just where you might see us out in the community. We've been really trying to spread music therapy throughout the Athens community. There's been a lot of buy-in from the community and support for music therapy. We've also have several great UGA grads that are also here that have private practices, and so they've been doing a lot of great work. And so we're starting to finally see some of the fruits of all of our efforts in the growth of music therapy and the support for music therapy for our entire community. So we hope that this gives you a little sneak peek into what we're doing. And now we're going to switch gears and talk about how some of the things that we learn might be able to help you. So we're going to talk a little bit about individual wellness.
Okay, first, we're going to talk about, we've already talked about this a lot, the cognitive benefits of engaging in music. And so what we see here is a tomography scan of the brain in 4 different states. So this first state is just the brain at rest. So we see activation in the prefrontal cortex, in the cerebellum and the occipital lobe. I guess this person had their eyes open. Then the next image is just the brain processing language. So we see a lot more activation. We especially see activation over here in Wernicke's areas and Broca's areas. Those are the areas of the brain where we are processing speech and language. We also see more activation in the frontal lobe and in the cerebellum. But then let's add music. So this is a music-only condition. We see this activation in similar areas, but we see it across the brain. So I think in previous times there was this idea of the right brain versus the left brain, and where our left brain analytical side. I'm not good with my right and left. And the right brain creative side, and we know that that's
actually just not true. That the arts really use our entire brains, and music specifically. So we see activation in without even adding language to music. We see activation in the speech and language centers and Broca's and Wernicke's areas. We also see this is a person at rest. This is our motor cortex across the brain. So we see activation there in the motor cortex, and then obviously in the temporal lobe. And then when we pair language and music, we lose a little bit across the motor cortex, but we add more activation in the speech and language areas. And so all of this to say, engaging in music in general is good for your brain. And when I say engaging in music, one thing I am not meaning is passively listening. You know, you're studying, you're working, and turning music on in the background. Actually, there's studies that say that's listening to your preferred music while you're trying to focus is actually not as helpful because you're wanting to engage in the music and not pay attention to your task. But when I say actively engaging, I mean going to a live concert and tapping your feet along to the beat. I mean, if you've ever wanted to learn the guitar, now's your time because it's really good for your brain. If you want to engage in any sort of music learning or just sitting back, one thing I'm a big proponent of vinyl. Actually, the movement of putting the vinyl on the record and sitting down and just listening actively, picking apart the parts that you hear. What's the bass doing? What's the lyrics say? Where's the rhythm? What's the tempo? And really fine-tuning that music, it's a whole brain workout. So just using that as your knowledge if you want to continue to support your brain's needs as you grow older, continue to engage in music.
I'm going to talk a little bit about emotional regulation because this is a really big topic and something that we've been talking with other professionals across the campus, specifically in the psychology department, and looking at adolescents and the increase in symptoms of depression and suicidal ideation. And so on the left-hand side, you're going to see me, the diagram shows you the algorithm that something like Apple Music, Spotify, or Pandora uses. And so when I like to think about that, the only thing I wish I could change about these graphics is I wish I'd put one as a funnel, which is this one. This one stays as a box. It's straight down. It takes what you want to listen to and it keeps finding more of the same and more of the same and more of the same and more of the same. So it's going to take whatever state you're in when you're listening to this music and it's going to keep you in that state. As music therapists, we use something called the ISO principle, and that's where we use music to match your state, your mood, and then we change purposefully the elements of the music to move you to a different emotional state. So maybe we're starting agitated, and so our music is fast, it's loud, and it's complex because we're going to get your attention from being in that state of agitation. All of us have been with agitated patients in the hospital where they have called us and they're like, if you don't come help, we've got to restrain this patient. I've had maracas thrown at me, all kinds of things. But almost every time when I've left that room, they've been asleep and unrestrained just through my use of music. And so what I'm doing is I'm systematically changing the tempo, the volume, the rhythm, the complexity of the music, and slowly following the patient and guiding them till we're finally in a relaxed state. And so my music by then is probably only 60 beats per minute, and I probably started about 120 before. And it's very soft, and my rhythm is very simple. But I'm watching them, and if they go backwards, I'm going to go backwards with them, capture them again, and move them there. So you can't have me in your back pocket on a day when you wake up not feeling like you want to go to work or like you want to do anything that you have to do, right? You can't have me in your back pocket. Sorry about that. But Spotify automatically making your playlist for you is not the move. Use our principles and create your own playlist. So start with that music that's like meeting where you're at. Like, yeah, I want to be in bed. It's cold. It's dreary, and I just want to stay here, right? Go ahead, validate those feelings. They're real. Use your music to validate that, but don't stay there. Change the playlist and gradually take yourself to something that you might do when you're out walking around or on a bright sunny day, a music that you would pick for that day, and move yourself in that direction. And so this is just a principle that you can take with you and try to use. And so we like to caution definitely our students as well when they're talking about their mental health, and they all say they use music for coping. So probably a lot of our students do across campus, and making sure they're using this tool wisely, because if we just kind of put it in Spotify or put it in Pandora, they're just going to stay in that state, and it can actually move them into a worse state. And we don't want that. We want to move them into a place of being better. Yeah, in that place of hopefully having a little bit of help to get them through their day and emotional regulation for that. So that's our takeaway from that one.
All right, and then I'm going to talk a little bit about memories associated with music. I think many of us, if I ask you what is your favorite type of music or who your favorite artist is, oftentimes that answer comes because you have some sort of memory associated with a song by that artist. I teach our Intro to Music Therapy class, and one of the first assignments I have our students do is create a music autobiography, where I have them choose 5 songs that are part of their story and share with me why. And in reading through those, I often find, because this is the song that my parents played every Saturday morning when we were making a big breakfast in the kitchen, or that's the song that was we played in my high school marching band show my senior year with all of my friends. And so we really have the students go through that so that they know how their relationship with music works, so that then they can bring music to other people in that connected way. Looking at these just stock photos here, we can see that, your first dance at your wedding is typically tied to a song, right? A meaningful song. Birthday parties and family gatherings are connected to a song. And, holidays and family traditions often have that musical component. And so the idea of associating memories with music is just to kind of get you thinking about, maybe I'm having a day where I'm missing a loved one who has passed, and there's a song that I can listen to think of them. Or maybe I'm feeling nostalgic and want to think about, my high school reunion that's coming up, and I listen to a playlist of all of those songs. And just kind of seeing how that can impact or influence your mood. One of the examples I share from my clinical work is I had a hospice patient, and the song White Christmas came out the year that she and her husband started dating. And so that was playing in the car when they drove home for her to introduce him to her parents for the first time. And so that was kind of their song. And they actually asked me to sing at the funeral, and they asked me to sing White Christmas as kind of a memory of that time in that couple. So again, that's a clinical example of a memory, but I think if we went around the room here and said, what is your favorite memory of your favorite artist, it would be tied to a song and a memory. And you can use that again on those days when you just kind of need a little extra support and supporting your own wellness.
So that's all of the stuff we had planned for you. We wanted to leave ample time for questions so that we can answer anything you might want to know about music therapy, about what we're doing, about our work, about our research, but also about how you can use these principles in your own life. So we'd be happy to take questions now.
Thank you so much. Questions?
Yeah, I listen. Thank you. That was great. I love the presentation. I'm curious, when you're being trained, do you all get exposure to like other types of theoretical orientation, stuff like that, and then do you integrate that with the music therapy?
So our students take lots of courses over in the psychology department, and so they get some of that there. And then in their senior level class, I kind of integrate it with using different psychological frameworks and how that changes what we're doing for music therapy. And the basis through that is always what is going to work for the patient. Yeah. So whatever framework we need to approach for our patients is what we're going to do. So yeah, we go through all the different major psychological approaches and pair them with music therapy as well, and how that changes maybe not necessarily what we are doing, but the lens that we're using to assess the client. Yes, and their gains. Yeah.
there's a lot of theoretical approaches to music therapy in general.
I'm sure there's like very
Yes.
specific
Yeah.
orientations there for you all. Yeah.
And that's another reason why they get to supervise under all three of us, as well as we have several, like I said, several music therapists that are in the community, and they also spend time with them as well. So that way they get to see how everyone does it a little bit differently. And then they do that 6-month internship where oftentimes they're at a place where they might have 1 or 2 music therapists, and they get to see them as well, and spend time with multiple therapists. Yeah.
So I have a question for Jennifer. I've worked as a CNA with hospice patients for about a year now, so I'm curious to know, some of the work that I've done is with home care patients. So I was wondering how caretakers that are at home and not in facilities are able to connect with your resources, and also if your strategy for music therapy changes at all for patients in memory care.
Yes, that's great set of questions, really. So part of my research in designing support for caregivers was because I was looking for support for caregivers, and I was seeing there's a lot of support, like the Alzheimer's Association will support the person with the diagnosis, right? A lot of these organizations provide support for the person with the diagnosis, but not always the person caring for it. And that certainly has expanded in the 15 years I've been a music therapist. But I think organizations are starting to have more of a focus on holistic care and the idea of aging in place, seeing that the most beneficial thing for older adults as they age is to remain where they are. So how can we provide supports in the home so we don't have to put them in a senior living community and make them go through that transition at this stage of life? And so I think, places like the Care Center support group, that's a free resource that's provided to the community. And I know a lot of like the Athens Community Council on Aging has started offering support groups as well. So kind of tapping into those community resources and agencies that are providing the supports to caregivers. But one of the things that my students and I try to do at the end of each semester at the Care Center is do a joint session with the caregivers and the older adults with dementia to show them what we've been doing in our sessions, and also provide them with a suggested song list that we've seen good responses to, so that they can, use their Alexa at home, or they can create that Spotify playlist or go to the music channels on the TV and have that playing, just as a passive way to have music, but have music at home. And then your question about memory care, definitely our approach changes again based on the needs there. So whereas in hospice we're working on a lot of pain management, anxiety reduction, socialization, in memory care we're working a lot on that reducing agitation, especially at sundowning, when we see an increase in these agitated behaviors. I've done a lot of sessions where I'm playing the guitar and walking around next to that client on memory care because they're agitated and they're trying to go home, right? They're trying to leave. So using that ISO principle to make my music match that agitated state of that client, and then adjust my music to help them relax. But then also in memory care too, working on providing meaningful sensory stimulation. A lot of times I'll walk onto those units and The Price is Right is playing, and then Wheel of Fortune's on, and the TV's constantly on, because the thought is, well, we're providing something for them to tune into. But like we said, if it's a constant source of stimulation, we all know you can have the TV on for 3 hours at home, but how much did you actually attend to? So by me coming in and providing that patient preferred music on the unit, it oftentimes will provide something for them to attend to and meaningfully participate in. Great questions, thank you. I don't think you can what you do.
Yeah. That's actually, there's a couple of newer studies that have come out, and they've actually been looking at the piece of silence being key and the effectiveness of music. And so the example I like to give is at the holiday time, when you walk into a store, what do you hear? You hear the Christmas music. By the time you've gotten all of your holiday shopping done and you're checking out, what do you no longer hear? The music. Our brain is really smart. And so what it does is it melds that music into the background noise. So it's not paying attention to it anymore. So it's instead attending to the other tasks you have, which is kind of what's happening when you're listening to music when you're doing other tasks, right? So that's something to really think about, is that silence and the breaks in between the music are very much a key in that active brain participating in listening and attending to the music.
Wonderful presentation. Thank you very much. Really an ensemble. from musicians. I'm very interested in a convergence I can perceive and wonder what your feelings are. It seems to me that music therapy and music medicine are in the process of a kind of convergence, different as they are. Music medicine not usually mediated by therapists and so on. Give a couple of examples, my own work, and then really would like to know your opinions. I'm working in Ukraine, and I work in Eastern Ukraine with children with trauma and with sleep disorders. And this has been led by the hospitals. We began with therapeutic interventions, but the hospitals know that we have an EEG intervention to entrain. EEG, and they've been really encouraging us to do that. So we're ending up with, in Kharkiv, under the medical school there, we have a hybrid of a therapy intervention and a music medicine intervention. Similarly with soldiers in Lviv, we're dealing with rehabilitation of soldiers. And there again, our therapeutic interventions have been success. As you know, we write songs, we do things, we play rock and roll, we do all kinds of things. We get people moving when they're in sort of prosthetic care. Also, but then there's been a new kind of disease of the war there, which is a combination of First World War trench warfare and 21st century weapons, has led to brain damage from vibrational pressure and overblast pressure, particularly leading to Jacksonian seizures, which and so there again the hospital said, will you please try? Because we'd worked with their children and we've been very successful in reducing epileptiform behavior in their brain. And so it was the hospital that dragged us into saying, would you please combine this? So in other words, I'm making those points so this is not some kind of grand ambition on our part. We've been asked to do it, and I think we'll be asked to do it increasingly. So it's a big question. How do you feel we deal with this as a profession? It's a complicated one, isn't it? What are your feelings about it? How do we go from here with it?
I can start. Okay.
I would first say that we always, our baseline is always that everyone has good intentions. So we never think someone's bringing music with ill will. The thing that we always say is that many people, I think, are just uneducated in that music can be harmful if done the wrong way because it is so powerful.
Yes.
And so we need to just be protective in its use to ensure we're not doing harm. So when people ask for it, we're always trying to help them. I was just talking to a hospital the other day that they're like, okay, well, if we can't hire a music therapist right now, what are things we can do? How can we do this? And we're always willing to give and work with people on how you can start something that might show the benefits that might lead to, hey, now we actually want to buy in and do music therapy fully. But we also love collaborations and partnerships. And so I think the more education we have out about our training and what we bring to the table and how we can maybe help bridge the gap. I love just being a consultant with people and saying, okay, you got this. My work's done. I've done the education piece. Everything looks good to go. Go for it. And so I think having even more of these conversations and partnering all together is going to continue to elevate everyone's fields, right? Like if we just all work together and continue to communicate. But I'll let y'all jump in too.
I was just going to say two quick things. Number one, we say often music therapists don't own music, right? Like we're not the only ones who are allowed to access it, right? And so we welcome, the use of music in all of these settings by others. We don't own music. And the other thing is, oftentimes, especially in these medical settings, people who could benefit from music don't necessarily need music therapy. And there aren't always enough music therapists there anyway to be able to serve everyone that could benefit from music therapy. So that's why music and medicine and music volunteers are so important, because if I'm the music therapist and I have, 4 patients with pain and 3 that are isolated, and then someone who just would really enjoy to hear some music, well, that person's last on my list. But if I have a volunteer, I can say, well, you can go visit that person, right? And so I think it's figuring out where to best utilize all of the people that can provide it.
Yeah.
And then the last point, I was thinking about the differences, and we're coming from an American healthcare perspective too, and I don't know what like the train. Obviously, you're a very highly trained person, and you know what you're doing. So I don't think that like we don't think that you're causing harm in any way by what you're doing. But I don't know what the training looks like in Europe and in a lot of different areas of the world, or if there is even music therapy training. So we're just happy that you are doing what you're doing to help these people. And I'm really curious to hear too, because that's one of my areas of interest. I work, like I said, with the active duty military who also had complex blast injury with traumatic brain injury and PTSD. And there's a very specific constellation of symptoms when you combine those two. And so the Department of Defense created what's called the National Intrepid Center for Excellence, which was designed to specifically treat that. And then there's a lot of satellite centers, and I worked at a satellite center called the Intrepid Spirit Center in Florida, specifically working with those illnesses. So like I see the battle, like literally, figuratively, that of these like what you're trying to accomplish, because it's really difficult to treat. So thank you for what you're doing.
Thank you.
Wonderful. Thank you so much. That was absolutely powerful.